evening. Thanks for hanging out for the last session. My name is Amalia, and I work for an innovation firm called IDEO. You're probably wondering what this has to do with healthcare or Zika. Well, in this short 30 minutes, we're going to talk about approaches to problem solving for healthcare, so just stay with us. For 30 years, we've helped organizations and grow using human-centered approach to design that allows us to uncover and gain deep empathy for people's needs, desires, and aspirations for the future. We're not just designers, we're architects, we prototype, research, like Sarah, who's going to be speaking in a little bit, communicate, and code. We do this across verticals, so healthcare, commerce, financial services, and we do this with the power of sharing and collaborating to collectively push the edge of innovation. These approaches, we believe, can solve problems across borders and cultures. But at the heart of everything is people, understanding and empathizing with people. This little sketch is a part of our secret problem-solving sauce. It's actually not a secret at all. It's called design thinking. Many of you probably heard it by now. The term actually emerged from IDEO when our founders were trying to figure out how to describe our approach. Design thinking is a human-centered approach to innovation that brings together what's desirable from a human point of view with what's technologically feasible and economically viable. We always start with people, and we keep them at the center of our process. Having a proven methodology that we've used for over 30 years helps us tackle complex problems for our clients, and has helped us make some of the most innovative companies successful today. But design thinking and our ability to innovate depends much more than on a specific methodology or approach. It involves a set of shared mindsets and behaviors that help create a culture of innovation. We say these 3 words every day, multiple times a day. When we define our challenges, we build a question in a really optimistic way. Not can we, but how might we? We take a big, scary question and make it feel accessible and addressable. We like to experiment too. 5 years ago, we thought, what would it look like to open up this creative problem-solving process to the whole world so people everywhere can collaborate to tackle some of the biggest challenges? And that's when we created Open IDEO, where we run challenges that bring diverse people together, students, designers, entrepreneurs, healthcare professionals like yourselves, and anybody in this world really, to share inspiration and develop ideas together. We open up this human-centered design process to a global community at Open IDEO. Now almost 100,000 people who work together to share and collectively improve ideas to pressing social and environmental issues. It's basically a startup within IDEO. We open up this. So design thinking is a cyclical process. We use an easy mnemonic: inspiration, ideation, and implementation. But it breaks down to these 5 steps. Inspiration is interviewing, observing, studying extremes, being inspired by analogous groups, not just other companies. Like, what about using veterinary medicine as inspiration? From empathy, you can better define the problem. In ideation, you're imagining a huge variety of directions, thinking expansively and diversely, and suspending judgment while doing so. Once you have this expansive list of ideas, you can narrow in on the 1 to 2 that you want. Then you prototype and test and see if they fit, tinker with them. Then it's time for implementation. So roll out your solutions in an intentional way, reinforce and celebrate them, make them public. There are a lot of ways of taking a human-centered approach to design and build empathy with the people you're designing for. We have over 50 different methods, but most of them can be boiled down to these 3 things: observing, listening, and putting yourself in someone else's shoes. This last photo here on the right is someone who is participating in the Open IDEO Ebola Challenge this past fall, where we were designing better personal protective equipment for caregivers. Much of our community tried to simulate what healthcare workers go through while wearing their PPE. We use these missions at Open IDEO to help people build empathy. That's essentially the tools from the design researchers' tool belt, like studying people where they are, interviewing, getting out there and trying something, studying extremes, using a different lens to get inspiration. Earlier month, we were called on by USAID once more to help surface ground-level insights and spark innovative ideas to address Zika and future threats. The Zika virus outbreak has been declared a global health emergency by the World Health Organization, has affected over 40 countries, and estimated to affect about 4 million people this year. Just on Friday, they announced that the first case of the Asian strain of the Zika virus was found in Cabo Verde, Africa. So it was most likely imported from Brazil, and it's further proof that the outbreak is spreading, and we need to reevaluate the level of risk and adapt and increase levels of preparedness. We're working with USAID specifically on a grand challenge. They're offering $30 million in funding for scalable ideas around Zika and future threats. Rather than just being reactive with Zika and Ebola and SARS, how might we get proactive and design solutions for vector and airborne diseases that we will inevitably counter in the future? Thousands participate on OpenIDEO.com and are empowered to take action, inspiring their local communities to get involved in tackling global issues. From there, we can showcase the potential of open innovation to rapidly respond to evolving crises. Our aim is to use the power of the crowd to inform, inspire, and guide creative solutions that are deeply grounded in what communities want. We're exploring how the Zika virus impacts people and local communities through research and use these stories as inspiration for near-term solutions. In addition, we'll think boldly about new and transformative solutions around prevention, detection, and response for future health threats. Going back to our tenets of design thinking, how do we approach this? The Ebola Challenge was a true design sprint. Relevant organizations threw out their standard playbooks to rapidly respond to the spread of this global public health threat. After the challenge, we discovered the critical role of creativity in emergency response. We narrowed it down to 3 ways that creativity supports innovation in the field of emergency response. The first, storytelling builds empathy. Effective human-centered solutions are rooted in the understanding of the needs of affected individuals in an emergency situation. Understanding the needs of someone in a very different context is the work of design research and ethnography. Effectively conveying those needs to others is the job of storytellers. Here's one example. This year, students from Pace University in the U.S. partnered with Brazilian students to address issues related to Zika. What was crucial in the development of the proposed solutions was the practical knowledge of Brazilian students about the disease. 2 mobile apps were developed at the university. Zika Defender is a game to raise awareness about the virus. Players eliminate mosquitoes before they can reach their targets, and they actually learn about the disease while they're playing. The game is addictive. And Zika Alert provides information about the disease, symptoms, prevention, transmission, and send reminders about important practices to follow. They created a human-centered solution. 2 is building on wild ideas. Wild ideas can spark new thinking and offer creative license to the professional emergency response community to suggest novel solutions. During the broadcasts of people working on the spread of Ebola, the presenters complained about or had noticeably fogged up goggles. One observer and contributor to the OpenIDEO Challenge thought, what could absorb all this moisture? It's hot in Africa, venting the goggles would be a no-no. So get ready for this. Tampon glasses. Why not add a section for a tampon to absorb all that moisture? It sounds a bit ridiculous, but wild ideas often influence novel solutions. Number 3, creativity for behavioral change. When a health crisis strikes, communities often need to change deeply ingrained habits to protect themselves. Creativity helps us develop effective behavioral change campaigns during a crisis like Zika or Ebola. During the Ebola outbreak, there was a lot of fear of Westerners. Healthcare workers in personal protective equipment would come in and take away sick people, so they barricaded themselves. A major complication of the Ebola outbreak was a lack of heating context. PPE isn't simply an engineering issue, it's a nuanced cultural one that demands a deeply intentional anthropological approach. PPE looks scary, looks like a bunch of spacemen. Would you want to go in that room? So with small, subtle changes in PPE, aesthetics, and design, we could revolutionize the healthcare atmosphere across the region. Although it may sound silly, subtle, simple shifts could provide the most low-cost reformations that yield some of the most effective results. Rehumanizing healthcare and making it more accessible